While the state is making sure there's enough cannabis for medical marijuana patients, dispensaries are expected to be a lot busier than they have been. So how will that impact medical marijuana users needing to fill their prescriptions? News 8's Tina Detel is live at the Botanist in Montville with more on that. Tina.
Good evening, Ann. Now, already this dispensary sees between 300 and 400 medical marijuana patients a day, so certainly they expect it to be a lot busier tomorrow. I want you to take a look over here. You can see they've already set up cones along the roadway. This is Route 32. The town has also allowed them to set up satellite parking lots with a shuttle service here tomorrow, but they say that their priority remains their regular patients.
Break those boxes down so we can get rid of those.
The Botanist in Montville closed early today to get ready for what could be a huge influx of customers seeking to be part of the state's first adult-use recreational marijuana retail sales.
We're going from roughly 50,000 patients in the state of Connecticut that can shop at 18 different locations to roughly 2.9 million people that are of age to be able to purchase amongst 9.
The Botanist has set up this tent outside for education about the product and information about online ordering, but then the recreational use customers will head inside along with the medical marijuana patients.
The folks that we really think are most important to bringing the stigma down in regards to cannabis.
And they will be a priority, getting to walk right into the building as soon as they arrive.
Also, our medical patients will be able to shop between 8 and 10 a.m. and receive a 20% discount, being able to come in a little bit earlier for us so that we can make sure that they don't get caught up in some of the lines that we're expecting.
Folks here say that the medical marijuana patients are VIPs, so not only will they have easier access and separate lines inside, but as you can see, they also set aside some reserved parking spaces for them as well. But will growers be able to meet this new higher demand?
I don't think we know the answer to that question yet.
Dr. Andy Salner, the director of the Gray Cancer Center at Hartford Hospital, was an early advocate of medical marijuana and says there is concern certain forms of medical marijuana could be in short supply.
Particularly for people who have significant pain or other symptoms who really rely on it to help relieve their symptoms, it could potentially be a hardship if they can't access it.
Now, the doctor says only a small number of cancer patients use medical marijuana, but they use it for things like pain, also seizures and nausea, trying to control things like that. And those who do use it, he says, are often advised not to smoke it, so they use edibles and other forms, which there is a fear or concern could be in short supply. Now, coming up at 6, we'll take a closer look at the security and traffic control measures that are in place in anticipation of tomorrow's crowds. We're live in Montville. Tina Detel, News 8.